Good morning, I'm Dr. Liu from Kaohsing Municipal Ta-Tung Hospital, Taiwan. The topic of my presentation is about the effects of the high-intensity focused ultrasound, also known as HIFU, ablation treatment for the uterine fibroids on genitourinary symptoms. From the beginning of my presentation, I'd like to say that I, Liu, have no application to disclose in this presentation, and the funding of the speaker to attend is self-funded. Uterine myeloma are the most common benign pelvic tumor and is affecting 25 to 30% of the women during their reproductive age. And the clinical symptoms that it brings could seriously affecting the quality of life with such menorrhagia, lower sex symptoms, and adjacent organ compression, pelvic discomfort, dysmenorrhea, dyspareunia, and infertility. Ultrasound-guided HIFU is a novel, non-invasive local thermal ablation technique. It's an alternative treatment in women who wish to have uterine preservation and to preserve their fertility, and also in women who have poor compliance and side effects to medical treatment. During the treatment, the ultrasound beams penetrate the tissue into the acoustic pathway and then focus on the uterine fibroids. And when the temperature increases to 65 degrees Celsius, coagulation necrosis occurs in the uterine fibroid in order to achieve the non-invasive ablation effects. And the objective of our study is to evaluate the effects of the HIFU ablation therapy of uterine fibroids on genitourinary symptoms as well as the clinical effects after the HIFU therapy. From April 2015 to June 2019, a total of 75 patients suffered from symptomatic uterine fibroids underwent HIFU therapy in Camp UH. Before and 3 months after treatment, clinical assessment by using MRI of imaging of uterus, questionnaire assessment such as OABSS, UDI6, IQ7, ICRGSF, and FISI score, and we also measure the volume changes of the uterus and the uterine fibroid lesion after the treatment. These are the baseline characteristics of women who underwent HIFU therapy. The mean age is about 39, and most of them are presented with multiple fibroids, and most of them have the antevertebral uterus, and they have most fibroid types are intramural types, and most of them have anterior wall myeloma, and the mean size of the uterus is about 630 centimeters square, and mean size of the fibroid lesion is about 175 cm square. There was a significant improvement in the uterine reduction rate and fibroid reduction rate after 3 months post-HIFU treatment. Significant improvement in genitourinary symptoms were also found with the total reduction in the OBSS, UDI6, and IQ7 ICRGSF score after the HIFU treatment. The scores of all parameters of SIFQ questionnaire improved significantly after the HIFU treatment, except in the certification and pain domain. These are the articles that used to evaluate the efficacy of the treatment outcome of HIFU uterine ablation therapy. This is a multi-center retrospective study including 9,988 patients, and 88% of them underwent successful ablation with mean volume ablation rate of 83%. This review of 8 articles shows that symptoms improvement after the procedure was 48% at 3 months and up to 89% at 6 months. And there was also a significant reduction of several symptoms with 88.5% at 6 months after the treatment and 48.8% after 1 year treatment. In conclusion, HIFU ablation treatment for uterine fibroids shows significant improvement in uterine reduction rate, fibroid reduction rate, and also genital symptoms after the treatment. Successful ablation and shrinkage of the uterine fibroid size alleviates the bothersome genitourinary symptoms, and HIFU can selectively induce typical coagulation necrosis in the fibroid lesion and leading to loss of function or growth or bleeding, and thus relieving the fibroid-related symptoms. That's all about my presentation. Thank you for your attention.